I'm Paul Gianfrido, and I'm President and CEO at MHA. When you're part of a multiracial family like I am, the conversations tend to be a lot more complex than I think the conversations are in families of a single race. In particular, my white family, when I was a kid, talked very little about mental health issues, and when there were members of the extended family who seemed to have behavioral health conditions, we kind of set them aside a little bit and just figured that that was the problem that particular relative was having. Similarly, when I adopted my children, at the time they were infants, we talked a lot about race and the impact of race on an adoption and on an adoptive family. But what we didn't really talk about was the impact of mental health conditions on people of different races and the way people would be responded to based on the race that they were. For example, my son Tim, who I've talked about openly, and he's talked openly about his issues, as a young African American male, was not really always accorded the respect and dignity that we would have expected of clinicians, of educators, and others who kind of took it for granted for some reason that young African American males who were fairly big and challenging in some ways, they kind of took it for granted that he was behaving in a way that was consistent with the way somebody of his race might behave, whereas in fact, he was behaving consistently with the way anybody who had a serious mental illness would react. So for us, it was a little complicated when race got mixed up with some of the conditions that we were facing. And I think for all of us, and all of us have had our own share of mental health challenges over the course of our family's lifetime, for all of us, I think it's been compounded in some ways and made more complex by the fact that we were a multiracial family.